I'm a mom of 3 little boys via 2 surrogates, well, 3 surrogates, 3 egg donors, and what a challenging journey I went through. So after that, I decided to be an advocate for parents because I knew how the system worked, how everything worked. And I vowed that I would make it so that everybody would be educated on how we do this so that you walk home with babies. So it first starts with the egg donor and, of course, your sperm. When we have 2 dads that want the same egg donor, the whole thing here is finding the right egg donor that produces the right amount of eggs that we can split. So you choose your egg donor. A lot of people will do it online or different ways. Oh, this donor looks great. There's way more to it than that. Because if that donor doesn't produce enough eggs for you, you're not going to get babies. That's what it boils down to. The donors have to be able to have the right amount of eggs so that you can get the embryos. That's where it starts. So as the embryologist, she's going to explain when we get, so we're going to talk about some kind of numbers.
Right.
So everybody,
so you can get an idea of how it all works. So the donors are stimulated. Once the donors are stimulated, they're continually monitored throughout their cycle so that the physician, which would be Dr. Perez, sees how many follicles are growing. The number of follicles that are growing give us an indication as to how many eggs this donor will produce. Now, follicles are on both the left and the right side of the ovary. When these follicles are produced, we get eggs. We keep monitoring until they're a particular size. Once the follicle is a particular size, the patient gets what we call hit with HCG or Lupron. Now what that does is it amps the follicle up and causes it to expand even further and help the egg that's inside mature. That egg matures. Most of the patients have at least 24 to 30 eggs retrieved. And in some instances, we get 57, like with one of our patients that we're lucky to have 57 eggs. Now, you don't normally get that much, but you can get a lot. When you have that happen, the eggs are split. So let's say, for instance, 24 eggs are retrieved. You have 12 eggs for one partner, 12 eggs for the other partner, for the intended parent, which is the terminology that's used. So the embryos are created from that one donor using partner A's sperm to create and partner B's sperm to create embryos. Now what happens is the embryos are observed for a number of days, up until day 6. Embryo cryopreservation now happens on day 5 or day 6. When those embryos are created, the embryos are frozen, and let's say you get about 6 to 7 embryos per person, per intended parent that get to be frozen. That's a big number. When you put it together, from 24 eggs, about half of them at least can get frozen. Normally, it's about a third of them that can actually make it to the blastocyst stage and get frozen. Sometimes you're lucky enough to have more. With that being said, our facility is one of the few that will transfer 2 embryos, one from each intended parent, which means that the genetic material from partner A and the genetic material from partner B, along with the donor, can be transplanted into the uterus of the patient, which is the gestational carrier. For all intents and purposes, when she gets her blood test, in 9 days, we'll know whether or not she's pregnant, whether or not this worked. And we'll know how pregnant you guys are, because if she's pregnant, you're pregnant in my book. Because you're going to be going through all of this with your surrogate, making sure she's eating properly, making sure she's getting all of the things that she needs so that your babies can grow up healthy and be healthy until that day that she graduates, gives birth, and you guys aren't sleeping at night with all the feedings you're going to have to do. If you have 2 babies, then that's double the work, but it's wonderful because that means one baby's genetically linked to one parent and the other one is linked to the other. If you choose to only have one embryo transferred and the embryo takes, the gestational carrier is pregnant, you give birth, survive that potty training, you can come back and have a genetic sibling, or the second embryo can be from parent B and the gestational carrier carries that baby, and then you each have a genetically linked child.
So going back to the donor, we do something that most donor and surrogacy companies do not. We pre-test the donors. There's a blood test called an AMH level. Not all donors have enough eggs. Even if you're a single parent, you still want a lot of eggs because it's numbers, and they don't all fertilize, they don't all become blastocysts. So we pre-test each donor before they get into our program. Probably out of every 10 donors that pass our criteria in the beginning, maybe if we're lucky, we get 2 that actually get into the program. Because we have this incredibly beautiful girl that just graduated with a master's degree, find out that her AMH level is a 2.1. We know that that correlates to how many eggs that we're going to see. That's probably going to be 12 eggs.
Yep, 10 to 12 eggs.
10 to 12 eggs, correct. We're not happy unless we have, if it's a single dad, we have to have 15 eggs plus. If it's 2 dads, we want 20 plus. Absolutely. We want to do this right the first time. So we have, what's interesting at Boca Fertility is we have steps. First, they have to get through the AMH and be put into our program. Then background checks, psychological testing. Then once you select that donor, we bring her in for the second phase. She's not totally complete. We do what's called an Antral follicle count. The doctor's gonna go in, he's gonna do an ultrasound, and he's gonna count how many eggs. The IVF nurse calls us, said, we got 32 eggs. We're a go. Then we tell you guys, guess what? She's a go. Right there, we have fail-safes. If they call back and said, well, you know, our AMH looked good, but we only see 13 eggs. I go, that's why we have choice 1 and choice 2. I call you and I say, you know, our AMH, this doesn't it really correlates. We don't see this happening too often, but we can be surprised, and then we say, we don't feel comfortable. Nobody else is going to tell you that typically, because they want to take the money and go and get this going. We want you to walk home with the baby. That's our goal. And that's what I went through. So this time we're going to do it the right way and do everything possible that at the end of the day you have your babies. So I think some questions, does anybody have questions? Because this is the most important thing you're going to do throughout your journey. The donor. That is the most important thing. And here with what we do, our donors, our surrogates are only in the state of Florida. Why? If I can't meet them in person, see them, talk to them, be able to go when the babies are born, be at the hospital to help you guys when those babies are born, check on the donor, make sure she's great, everything is going well, they have to be in Florida. And that saves you thousands and thousands of dollars instead of flying a donor all over the country or a surrogate, and then they say, I have a great surrogate for you up in Maine. Well, how many of you guys can take off a couple weeks of work to stay up in Maine until you can bring your baby back, or at least a week, because you can't get on an airplane? That's why I look out for my dads. We want to be in Florida so that if you want to go to, and if you're not from Florida, you want to be where everybody's at so that you can have the support. Questions?
What is yours? I know you have a rigorous screening process for your donors, but how is your screening process for your surrogates?
Oh, they go through an extensive background check. If they're married, their partner has to have the background check. If they're with somebody, they have to have a background check. Both of them has to have a psychological background. Very thorough. We check their credit, we check everything. So we make sure, and what's kind of nice is that we have this incredible group of surrogates, and one of them is back here. Amanda is one of our repeat surrogates. And I think Amanda's referred me 5 other surrogates, so we know them through each other. And they refer to us because of the camaraderie and what we do. And we have a mentoring program where Amanda mentors the other new surrogates coming in, so they have everybody to talk to. That's really important. Then it just makes it so much nicer. Do you have anything to add with this, Pat?
Does anyone have any questions for me?
Well, no,
go
just
ahead.
for you. The journey to find a surrogate, is it long with you? Do you have a lot of
No.
surrogates? Or?
Yes, well, as soon as they come in, they're gone. But to answer your question, our lead time is 2 to 3 months. Not 6 months, not a year, 2 to 3 months, because the girls are constantly referring other girls to us.
And you have the insurance team already managed there and everything, right?
That's another conversation, but every surrogate ends up has a health insurance policy. Absolutely. Not Medicaid. Regular health insurance policy. If anybody mentions Medicaid to you guys, run. Because we do it the right way. We do everything the right way. And I'll explain how all that works with the insurance.
So you say like the surrogate carrier have the insurance, or we have to provide the insurance?
90% of the time, you're going to have to provide it. Because even if they do have health insurance, if they check their benefits, now some of them do, and we're surprised. Some of the girls have insurance that will go ahead and cover surrogacy. But if we say the word surrogacy to some of these companies, they won't cover it. So we don't want to take a risk. We do have a company that's even here that will review the policy. So we try to save money wherever we possibly can, but we have to make sure you have that health insurance for your sake. That was a good question, by the way. Come on, I know you guys have questions.
So what if I wanted to carry 2 babies at the same time? What's the approximate, the ballpark, the cost in total from the beginning to end for carrying the twin?
Well, you have insurance, so you're going to have another doctor, which is a maternal fetal. Most of the Blue Cross Blue Shield health insurance that we get.
I'm not talking about insurance, the whole things for carrying 2 babies.
Well,
so.
for a surrogate, it just depends on which surrogate. If it's a repeat surrogate, I'll give you an example. If it's a first-time surrogate, typically in our program, she gets $35,000. If it's 2 and she agrees to carry 2, she gets an additional $7,000. So that's what our surrogates typically get. If it's a repeat surrogate, one who's been through the process before, she's delivered healthy, chubby little twins, and they went home in 48 hours, you're going to pay a little bit more because she's good. And that's Amanda back there. She's really good.
The repeat will cost more.
Correct. But not that, you're not talking 100,000. We're talking a repeat surrogate would typically, forget a single baby, would get between 43 and 45,000 for a single. For twins, she's going to get close to 47,000 because she's done this before and she's done a great job. But most of our girls start out as first-time surrogates. So